Hello everyone, this is Dr. Animesh Shah. I am a cancer specialist and today we'll be discussing about the genetic testing for cancer. Oncologists typically ask for genetic testing or DNA test to confirm whether somebody has got genetic uh, mutation or inherited cancer. In about 5 to 12% cases, cancer has been found to have a genetic or inherited association. If somebody is found to have a genetic mutation which can predispose the patient to cancer, then other family member might be advised similar test to check whether they also have the similar mutations or not. So genetic mutation can be in one gene or can be involving several genes. Researchers have found that there are about 400 different genetic mutations that can predispose an individual to the risk of cancer, and most of these mutations predispose a patient to a risk of cancer. Some of the examples of this kind of mutation and their cancer syndrome includes: number one, familial breast and ovarian cancer syndrome, which can be present if somebody has got BRCA gene mutation. Number two, Lynch syndrome, which is present when there is at 5 of the DNA repair gene get mutations. Number three, Lee-Freeman syndrome, which happens when TP53 gene mutations is present. Hereditary genetic mutation can cause different cancer, for example, breast cancer, ovarian cancer, prostate cancer, stomach cancer, pancreatic cancer, thyroid cancer, kidney cancer, etc. However, not all cancers are hereditary. For example, cervical cancer, head neck cancers, these are not usually hereditary. So according to National Cancer Institute, there are certain indication when to do genetic testing. Number one, if somebody has got cancer below the age of 50, if somebody's got multiple cancer. Number three, if somebody has got cancer involving both sets of organ, like involving both breast cancer, both kidney cancer, etc. Number four, if several first degree relatives of the person is involved with cancer. Number five, when multiple family members of the person is involved with their cancer. Number six, when there is some physical appearances that are linked with certain genetic inherited mutation. For example, in neurofibromatosis 1, people have multiple neurofibromas, that is small swelling arising from the nerves involving all over the body. Those persons should have a genetic testing. And if, number 7, if somebody has got cancer that is not particular for that particular age or sex. For example, if a male develop a breast cancer, that person should have a genetic testing. Genetic testing can be done from the blood sample or saliva sample or urine sample. In a diagnosed patient of cancer, it can also be done on the biopsy sample. So genomic testing is one of the tests that might look into the genome or the DNA of the cancer patient, and that will help us or the oncologist to understand how the treatment, how the cancer will behave or grow over time, and what treatment might be effective for that particular cancer patient. This is often called genomic sequencing or DNA sequencing because it doesn't look into the one single gene, it often looks into the a set of gene or genetic mutations. So you might have heard your doctor talking about genetic testing as well as the term genomic testing. They sound similar, but they are a bit different because genetic testing is basically looking for inherited genes or genetic mutation, which might predispose an individual to a risk of cancer, or it might also help us to understand if the person gets cancer, what is the likelihood of that cancer. Genomic testing, on the other hand, is screening the genome for various mutations. That helps us oncologists to understand how the cancer might behave in future, how the cancer might grow in future, and what might be the treatment option for the cancer patient, whether there is any effective target therapy that can be used for that particular cancer patient. That's all for today. Thank you for listening.